Oh, my heart. It hurts so much. Oh, like it's caught in a vice.
Oh, my little boy's in love.
I think he's having a heart attack.
Come on, son. You can fight this. Do the Birdman. Do the Birdman. Why don't you dance?
It is one of the wonders of science, genetic testing. Doctors can now pinpoint DNA defects that lead to dozens of diseases, including a serious heart condition that affects over 500,000 Americans. Many don't even know they have it.
Well, there is a common heart defect that kills dozens of seemingly healthy children on athletic fields every year. But now a powerful genetic test is being used to help save thousands of young lives. CBS 2's Dr. Holly Phillips explains how it works.
Basketball great Reggie Lewis died suddenly from a heart defect, and sadly, he's not the only young athlete to have this problem.
The most common genetic heart disease.
Hypertrophic cardiomyopathy is a thickening of the heart walls, also called HCM. It affects 500,000 people, most of whom don't know they have it, and don't know that intense exercise could kill them.
The consequences of this disease can be catastrophic.
Joe Delmonico was diagnosed with HCM at age 42.
I could have died when I was younger, not knowing.
Because it's a genetic disease, Joe has a 50% chance of passing it to his 3 kids. But now a genetic test done with a robot and a small blood sample can pick up the disease. It helps doctors find and treat HCM early with medication or surgery.
It allows us to say for certainty that this patient does or does not carry the gene.
The Delmonico's 2 older children tested negative for the gene.
It's like, phew. Now my son can play basketball, my daughter can, ride her bike.
3-year-old Anna has yet to be tested.
I worry more about her because the other 2 are negative, and the fact that she's more like her dad.
But even if she is positive, just knowing could save her life. For this and many other diseases, genetic testing is the wave of the future. Dr. Holly Phillips, CBS 2 News.
So many times, cancer patients want to know why it happened to them. Could they have prevented it? In some cases, we don't do anything to cause cancer. It's in our genetics. That's why more and more people are turning to genetic testing.
Testing for heart attack and diabetes. Coming up in Take It to Heart, how genetic profiling is helping protect you from heart trouble. A simple cheek swab tells health professionals if Trudy Kernut carries the gene for heart attacks, type 2 diabetes, AFib, and irregular heartbeat, and more.
And if you do get a test back that shows that you are at a high risk, then better to know now than when it's too late.
What genes do is go beyond that, and they look at your lifetime risk. In other words, I could look at a 2-year-old and know what that 2-year-old's lifetime risk is based on their genetic profile for type 2 diabetes, for AFib, and for heart attack. Far different than just looking at risk factors alone.
Doneen says research is looking at how to prevent people who have, say, the diabetes gene from going on to get the disease. In the meantime, the genetic information gives doctors and nurses one more tool to customize your treatment.
It's opened doors and windows for screening technologies that we didn't even think about before.
The gene tests run between $200 and $300 per disease. Insurance does not cover it yet. However, many healthcare professionals are lobbying for coverage since they see the future of disease prevention in genetics.
Increasingly, science is discovering that some diseases may in fact be woven into our DNA. Now, in some cases, doctors can determine that risk through genetic testing, whether you have a higher probability of getting some diseases.
Having the gene, you're more at risk more quickly.
Lynch syndrome is caused by a genetic defect. If you have it, your chances of getting colon cancer go up to almost 80%. Lynch syndrome also causes the cancer to strike earlier, lowering the average age for diagnosis from 65 to 45.
Smokers without the genes have about a 1 in 6 chance of developing lung cancer. But in smokers who inherit the gene from both parents, the risk of cancer rises to 1 in 4, an 80% increase.
Genetic testing clarifies risk, and knowing your risk allows you to take the steps you need to protect your health.
So their father had the test and found out he was positive for a mutation.
I guess we don't hear as much about men carrying the breast cancer gene, and he came back positive. You know, I'm so proud of my dad that he got tested, and that he could give that information to us so we could get tested. If he had refused or didn't want to deal with it, we might have all backed away from the whole issue, and then we wouldn't know. I never thought about getting cancer. I was in my early 20s. But when I was given the information that there is a gene, that we might have the gene, I said, I need to know as soon as possible whether I have that gene so I can perhaps take action or at least be a little more cautious and aware. The more information I could know about my own body, the better.
8 months after her daughter was born, Lori discovered a lump in her breast, and armed with the knowledge of her cancer gene, she took aggressive action.
I went to the doctor and I said, I feel something strange here. Now the doctor said it's probably nothing, it's probably a complication from a blocked milk duct or something like that from breastfeeding. And I said, look, I'm really concerned here because I'm feeling something and I've got this gene and I need to at least check it out. And so the doctor did a biopsy, and a few days later I was in the middle of work and I got a call on my cell phone, and the doctor said, you've got breast cancer. Thank God I knew that I had the gene when I was diagnosed with breast cancer, because it helped me make decisions more quickly. It helped me make more aggressive decisions about my treatment. It gave me extra information that I really needed to know as I was dealing with my cancer diagnosis. I think women need to empower themselves with this information. Find out. Maybe you're negative. Great. It's a big relief. Maybe you're positive and you move forward with the information. But sitting around wondering, do I do it, do I not? It's stressful. We like to know how much we weigh, what we eat, what our cholesterol level is. Why not know this incredibly important information about the rest of your life, and information that could affect everyone around you and your family? So this is important information, and it's powerful information that can change a life.
For many people, knowing whether you have a mutation can reduce anxiety and stress.
I don't know if I have to convince you of this, but people talk about nature versus nurture, genetic versus environment, and I think this is a ludicrous argument to even be having, because it's absolutely true that everything is genetic. It's also true that everything is environment.
While there's a strong genetic component, there's also a strong environmental component to this disease. Many of the risk factors that occur, environmental risk factors that predispose to people having heart attacks. But as many of you know, people who smoked, ate a lot of meat, did all the bad things they could do, and they lived to be 95. And others don't do any of that, and they have a heart attack when they're 45 or so, like my father did. And so clearly there's some genetic component that's important, and it's critical to understand those to be able to direct therapies.
It's something in our genes.